Hi, my name is Connie Teal. I am the clinical nurse specialist in the Neonatal Intensive Care Unit at Akron Children's Hospital and the mother of this lady who's sitting next to me.
And I am Chelsea Neer. I am one of the neonatal ICU nurses here at Akron Children's.
I've been a nurse for 34 years. 33 of those years have been in the Neonatal Intensive Care Unit, and the majority of those years have been here at Akron Children's Hospital. I have worked as a staff nurse. I've been a backup charge nurse. I was an education coordinator for several years. I was a clinical case manager for 16 years, and I've now been the clinical nurse specialist in the NICU for the last 7 years. Once I went to school and got my BSN, I took advantage of the learning opportunities here at Akron Children's. I went back and got my Master's of Science in Nursing degree. I got a postmaster's certificate as a clinical nurse specialist. And then I most recently, 2.5 years ago, finished my doctorate of nursing practice. As a clinical nurse specialist, I'm working to try to find improvements for the care that we provide to our patients through evidence-based practice and through research. A clinical nurse specialist is also a clinical expert, and one of the things, some of the areas that we work with are pressure ulcer prevention and prevention of bloodstream infections. One of the things that I really love about my job, though, is mentoring our nurses and watching them grow and learn through their careers is very rewarding.
What got me into nursing as a kid, I knew that my mother was always a nurse, and she used to tell me about some of the amazing things they would do in the NICU to help out with various patients. My aunt is also a wonderful nurse, but the main reason that I went into nursing was when I was about 15 years old, my dad had 3 heart attacks in 1 week. And while he was in the cardiac ICU, it was amazing that I had a family friend whose mom actually was there taking care of him. And she didn't only focus on taking care of my dad, but also my mom, who was there for the entire time, and also my brother and I while we were there as well. So I decided to go and be a part of nursing, not only just to take care of the patient, but also to take care of the family as well, and realize that it is a whole component for holistic care. I started here in Akron Children's as a new grad. I worked in the PICU for a little over a year, and then I loved the PICU and the ICU component. My heart always led towards neonates, and when I got to float over here, it was such an amazing opportunity. So then I finally became a neonatal ICU nurse, and I've been one for about a year now. I have loved working in the NICU so far. It has been amazing. The various babies that we take care of who come out at such a young age and how they're able to grow and develop and go home. And even some of the babies that we see that are oh so sick that can push through and fight through. And you see how the family is also such a huge component to that, to helping them be better. I absolutely love this job, and this is a job I would never have thought of as a kid, but I'm grateful that I've had my mother who showed me how to be a nurse like this and to have such a great career and a work family like Akron Children's.
And I feel especially blessed to be able to watch Chelsea go through her growth here in the NICU, and I think it's every mother's dream. You want your kids to be happy and successful, and I have the opportunity to see that every day while I'm at work. Every day we talk on our ways home about how our days have gone, how our job has gone, and talk about the challenges as well as the successes that we've seen each day. And I can't think of a better way to celebrate 2020, the year of the nurse, than to be able to watch my daughter grow through her career here at Akron Children's. And we just want to thank all of you for the opportunity to present our story today.
Thank you.